You're watching Fox 10 Arizona Morning with Ty Brennan and Anita Roman in HD.
Have you ever wanted to ask a dentist about, well, anything? Well, coming up now is your chance. We've got all your questions, burning dental questions, coming up after the break. Stay with us.
All right, coming up, fact or fiction, what you really want to know but might be too afraid to ask your dentist. We have one live in studio when we return.
Stay with us. We'll be right back.
You'll be a dentist. You have a talent for causing things. Some be a dentist.
A fitting song. All right, let's face it, going to the dentist is not a top 10 favorite thing to do for most people. So
I love it, actually.
I like a good cleaning when I have a good, clean bill of health. So in honor of National Children's Dental Health Month, we asked our Facebook friends if they had any questions they were too afraid to ask their dentist in person, not just about their kids' dental health, but of course, their own.
Yeah, dental health in general, right? So joining us this morning is Dr. Praviti Adhikari from Artistic Dental at the Biltmore. So I think a lot of folks, do you notice that people come in, they're a little hesitant to come into the dentist?
Absolutely. Who likes going to the dentist except for Ty?
I like it.
I love getting my teeth cleaned too.
As a kid growing up, I never had cavities, so I really looked forward to it.
I think if you have positive experiences when you're younger, which is why it's so important to bring your child to the dentist, especially when they don't have problems. When they do have problems, it's not as intimidating.
Right.
So we do have some questions from our Facebook friends. Our first one here is from James Raitt. He says, what's the best method for pulling out my child's teeth? He probably means baby teeth, I'm hoping. He's not just ripping them at random, right?
The great thing about primary teeth is generally they fall out on their own. When a permanent tooth is ready to erupt, that primary tooth, the baby tooth's roots will resorb, and so the tooth becomes wiggly. The best person to take out the baby tooth is actually the child, because you don't want, the child is going to be the one that can assess whether it's wiggly enough, whether it's comfortable enough to come out.
I remember that feeling of the tooth just hanging.
And when it's like that, you want to encourage them to play with it, to wiggle it, to push their tongue up against that tooth, eat lots of crunchy foods, anything like celery, carrots, and eventually that tooth will come out.
So just have it naturally come out.
Have it naturally come out. Okay. If they do ask you though, then it's really simple. Put a piece of gauze on the tooth, a little quick twist and pull, and the tooth will be out.
All right, Patience has a question for the dentist. She says, I have a problem that always keeps my body in malnutrition mode. I floss and brush daily, but I'm still getting decay. My doctor said that this is normal as my body is saving itself, not my teeth. So my question is, can I use any type of enamel repair toothpaste or mouthwash out on the market to help this problem?
There's actually so many products out there that help with preventing tooth decay. There's products with fluoride in it. Fluoride is a naturally occurring mineral, and it really helps by strengthening the outside of the tooth, the enamel, and making it more resistant to acid attacks.
I have a prescription toothpaste with additional fluoride that I use just a little bit at night.
That's great. That's great because it's actually sitting on your tooth and doing a lot of work.
Okay.
There's also ACP, amorphous calcium phosphate. It's a compound, and it acts as a delivery system for fluoride to get onto your tooth as well. You've probably heard of products with xylitol in it.
Yes.
Xylitol is great. It's a natural sweetener.
And it comes in gum.
Yes.
It comes in gums, it comes in mints. You can get the fluoride in mouthwashes, in toothpaste, and all that will help remineralize and rebuild, strengthen your teeth.
So to answer her question, yes, she can buy any product out on the shelf.
And a dentist will help you navigate through it. There's over the counter, and then you can also get the prescription stuff from your dentist.
All right, one last question here. This one is from Angela Hubbard. My son has a heart condition called tetralogy of Fallot. Am I saying that right?
Tetralogy of Fallot.
Fallow, excuse me. He had a full repair at 3 months and a donor valve put in last April. He is 4 years old now. What question should we be asking the dentist when we make an appointment?
You know, this is a great question because it highlights something really important. Whenever you're seeing any medical professional, you want to be completely transparent when it comes to the child's health history and the medications they're on. There are so many contraindications and ways that we can adjust treatment. I would call and make sure they're comfortable treating kids. As soon as you know that they are, when you discuss your health condition, with a valve replacement, you're gonna probably, after talking to the cardiologist, give them antibiotics prophylactically. So they are at a higher risk of infective endocarditis, and the antibiotic will help prevent any bacterial infection if they have invasive dental treatment, like the extractions we were talking about before.
It sounds like the best thing to do is really to just be as open and honest and unafraid of your dentist as you can be. Just tell them what's happening and they're going to help you.
Absolutely, and make sure they know everything. Sometimes people assume that we don't need to know everything, but there's things that we're doing, and the oral cavity is the gateway to the body.
Yes.
So you want to make sure that we know everything and all the facts.
Great information. Thank you so much.
Thanks for having me on again.
Yeah, as always, thank you so much. We will be right back.
Stay with us.